Yes, thank you, ladies and gentlemen. My name is Dr. Victor Obasuyi again. The channel is My Take on It with Dr. Victor Obasuyi. Having said that, I would like to appreciate all of you for the tremendous support that we've received since we started this channel, since we made it public about 2 weeks ago. The views have been quite encouraging. Comments are also very encouraging. But at this point, I just want to keep reminding you that if you've not subscribed to the channel, please do us a favor, subscribe, and continue to share. We don't know who will benefit from the talk. Sometimes it might not be you directly, but maybe somebody else that is related to you. So that's the essence of doing this video. So today I'm going to be talking about red eyes. A lot of us go through this from time to time, and what is the red eye telling you? Most times the people make the mistake of constantly masking the red eye with things like Visine eye drop, which is over the counter and probably found almost everywhere. As a practitioner, I think this is a very wrong approach. The eyes won't turn red unless something is aggravating it. So most times I recommend or advise that until you know what is causing the eye or causing the redness, don't just mask it. Even if you do cosmetically, please still go ahead and seek medical advice or medical opinion. Sometimes redness could be from basic things like allergy. It could be from dry eyes. It could be from a lot of things. But bottom line is, when the eye turns red, it's telling you that something is wrong. Because when the redness that you see is from the blood vessels, the blood the blood trying to come into the eyes to bring in like the white blood cells to fight whatever is the problem is. So that's what you see as redness. And the white blood cells are like soldiers. They don't just come out. They only come out when there's need for it. So my take is, anytime the eye is red, please do not mask it with Visine. Go ahead and seek attention. If you find that the redness is, especially if the redness is significant, is a lot, is lasting more than a couple of days, there's pain involved, then I would strongly recommend that you get it checked until you know what it is. Don't just sit on it. I've seen cases of red eyes that turned out to be very fatal or close to fatal systemic conditions. And for a layman, I doubt if there's a way that you can tell that this is different from the other person that just had maybe bacterial or viral conjunctivitis on the eye and had developed red eyes. So until you know what it is, please always take time to find out what the aggravating factor is. Using antibiotic sometimes will work. But what you don't know is a bacterial infection or is a viral infection. Hot compress and antibiotic obviously will work if it's a bacterial infection. But suppose it's a viral condition that probably needs an antiviral or cold compress, and you're using the antibiotic and the hot compress. Antibiotic will still work in a way to prevent secondary infection, but it's not going to do the job that you need at that point in time. So that is the main reason I'm posting this out, so people will understand, because I see a lot of times patients bring their kids in. The child has a bacterial infection and they're treating it differently, or the child has a viral infection and the child is on antibiotic, which the parent probably picked up over the counter somewhere. So of course, with the help of the pharmacist, sometimes they are able to narrow it down and say, okay, you know what, this is what you should be trying. But that is not the end. The end is you might use that as a temporary measure, but still take the child to see the appropriate, even a medical doctor or an eye doctor, to rule out what the underlying factor for that redness is. Sometimes it could be even as bad as glaucoma. You don't know. So, but until you know, then don't just mask it and think it's okay or it will go away. So thank you so much. This is the little video or a short video. If there's any comments, questions, please feel free to throw it in, and I'll be glad to answer your questions. Thank you, ladies and gentlemen.